Dr. Mother Candula with Advent. Today, talking about our patient journey, otherwise known as how do we find the solution that's right for you. And it is up here on this little poster here. And basically, it starts before somebody sees us at Advent. So life before Advent is up here, which for a lot of folks, it's folks who have nose issues, allergy issues, sinus issues, snoring issues, sleep apnea issues. Some of that, all of that, a lot of them feel dismissed. So either by the healthcare system or just by life in general, where people are dismissed and not. Their issues aren't taken seriously. So, I think it's key if you're stuck in this loop here, the key is trying to get an understanding about what's going on. And so that really marches down here, which is trying to, this represents, really coming into Advent and us trying to attempt and us trying to find, what's wrong and find a solution that matches up with that. And so, for folks that we see at Advent, they typically can kind of go down in two categories. Folks either want to sleep well or breathe well. So, if you have issues in these areas, you have issues in your breathing triangle. Breathing triangle is an Advent exclusive term, and it's an Advent exclusive concept, which really talks about your nose and your throat. So your two nostrils and your mouth, that's the breathing triangle, which is depicted here. So if you snore, if you have sleep apnea, if you can't breathe through your nose, if you have sinus issues, if you have allergy issues, you have a breathing triangle issue. Issues are in the nose and the throat, sometimes both, sometimes one of those areas. And when somebody comes in, our first step is we have to evaluate those areas. We need to look in the nose, we need to look at the throat, we need to figure out where the issues lie. So that's what we call the breathing triangle evaluation. If, for instance, your throat looks tight and you're snoring or you're feeling tired during the day, then you might have sleep apnea. And so we need to figure out if you do or you don't. So the way we do that is right here, which is a home sleep study. It lets us figure out if you're stopping breathing, if you're snoring, to what extent, all of those sorts of things. So if we look at you when you come in the office and we look in your nose and we see that where the sinuses come in, those areas seem tight, then we need to also evaluate those areas more fully. And so what that leads to is an in-office CT scan or in-office CAT scan. So the options for somebody who has a nose issue is really medications. That's one option. There are medications that can work. Those medications can only really work after we have evaluated your breathing triangle and figured out what's wrong and what medications might actually help you. So there's two different pathways for somebody who has a nose issue or a sinus issue as far as treating the anatomy. One is an office-based approach. So this is where balloon sinuplasty, for instance, comes in, or turbinate reduction. That's another procedure we can do here in the office. An alternative option for some folks is surgery. If surgery is an option for somebody, then we'll talk through the pros and cons of that approach versus an office-based approach. And then the final solution is really talking about the throat. That's where sleep apnea happens. And so if somebody has a snoring issue or has a sleep apnea issue that we defined with the sleep study, then we know we've got a throat issue. In order to treat that properly, your nose needs to be working first. Now, if you have a nose that's now working and you have sleep apnea or other issues going on in the throat, then really we've got three different options from a sleep standpoint. And these are all targeted at the throat. There are procedures that we might consider to open up tissue in the back of the throat or stiffen that same area. Alternative options really come down to appliances. So there's two different types of appliances for somebody who's got sleep issues. One is a Cpap machine. So a Cpap machine is a machine that you wear when you're sleeping at night that pushes air into the back of the throat and holds your airway open, holds your throat open. An alternative option is an oral appliance. An oral appliance is a dental appliance that's custom fit for you. It's fit to your teeth, and it's basically like an upper and lower retainer that are attached to each other. And we're using your teeth to basically pull your lower jaw forward a little bit to open up your airway. So again, it always starts in that same order, nose first, and then we're going to move into the throat. With that pathway and that exclusive breathing triangle option for us, evaluating in this manner, we can make sure we understand what's going on, get a game plan that's right for you, and then enact that plan in the lowest key, most active way possible. Make sure that that nose is working as a first step. And then if you do have sleep issues, then make sure that we're being gentle and effective as far as how we get that throat open when you're sleeping at night. So remarkably, when you follow this proven process through and we take the steps that we take here, our success rates for folks is extraordinarily high. This is all that we do, and therefore we need to do it well. And so really it's taking care of one patient at a time and finding the right solutions for you, and that's what we do.